Welcome to Hear Us Early, a podcast based on amplifying lived experience in child and adolescent mental health. health. Today, I am joined by Mr. Miracle Adesina, who works with Slum and Rural Health Initiative, an organization that is focused on amplifying lived experience. Welcome, sir.
Thank you for the invitation.
It is a pleasure to have you here with us, sir.
Mhm.
All right. Can you briefly introduce yourself and tell us the work that you do?
Thank you very much. My name is Miracle Adesina. I'm the country coordinator of Nigeria for Human Rights Initiative. SHRIN is a non-profit organization that is focused on improving access to healthcare, information, and services, especially mental health, for young people, for historically marginalized communities and vulnerable people, for mentally displaced people, to people living with different mental health conditions, among others. Nigeria has a worrying challenge. More than 20-30% of Nigerians have a mental health challenge or a disorder. And out of the 20, that's about 40 to 60 million, right?
Yeah.
And it is a sad reality that more than 90% of these people do not have access to the mental health care that they need.
Wow.
So we at Human Rights Initiative are working to change that narrative in access to mental health care in Nigeria.
Wow, that's very impressive,
Thank
and
you.
it's very amazing to hear the work that you're doing as the Wealth Initiative. And that will actually bring us to the first question. How do you ensure what you do as the Wealth Initiative? How do you ensure your work brings in lived experience to actually reflect the work that you do?
Thank you very much for that question. Because lived experience has been at the background of everything that we do before we start any project or any stuff in summer initiative. Before she was officially registered, the team, right then we are just a team of volunteers, went to the IDP camps in northern Nigeria to go and play football, skipping with the females, ludo, all those different stuff with the IDP camps there, with the young people, the boys and girls in the IDP camps. We talk to them about leadership, mental health, and all those stuff. So during all those conversations, that's when the young people started sharing their experiences, the traumatic experiences of them being woken up in the midnight by bomb explosion or
Wow.
bullet sounds,
Wow.
and most of them will tell you of the experiences now. They are unable to sleep, they're anxious all the time, different challenges that they face. They
Wow.
don't know that it's a mental health challenge, right? So because a lot of people come to the IDP camp, come and distribute food, to distribute clothes, but nobody asks them about their mental health. And the people that know it is mental health challenge, because there's some people that have like this challenge that is pronounced, they are ostracized. They are choosing to the extreme of that because they usually have
Wow.
nightmares and co. So those that know they have it, they don't want they are stigmatized. So even when people know that they have mental health challenges or disorder, they don't want to speak up because they
Yeah.
don't want to be stigmatized in their community and co. So like from the onset, before developing the solutions, we realized the challenges that they face and we developed a solution in line with them, listening to what they are saying, getting their feedback, listening to their challenges, thinking of okay, we want to develop a solution. How is the best way to develop a solution? So we heard from them and brought all these learning and reflections to create a method solution. Our flagship project, the Brave Art Project. So our project is grounded in the lived experiences. And also as an organization, our leadership team involves people with lived experiences. So it
Okay.
also ensures that even if you want to stray away, sort of, the individuals with the we have the lived experience also ensure we go back to the table and we always put lived experience at the center of what we do.
Wow, that's very amazing to hear,
Thank you.
and also it's actually reassuring to hear that people with lived experiences are the center of the work that you do as Human Rights Initiative, and you mentioned the Brave Arts Project. That you also work with people with lived experience. That's very impressive. That will actually lead us now to the next question. That how do you ensure that you mentioned something about listening to them, but how do you ensure that you're actually actively listening to these young people with lived experience in what
Thank
you do?
you.
Yeah.
The settings in which we listen to them is important, and we don't sit them down for interviews like this. That okay, you have a
Mm,
problem. How can we help you? No, it is
mm,
normal conversation,
mm,
normal gisting that you get. You just played football together, you passed to them, you
Mm,
scored the goal, or you just played Ludo together and you're like teaming up.
yeah.
After all this conversation, you are allowed to have
Pretty
all those
relaxed.
conversation or gist where they
Mm,
can tell you their real experiences, what can work. Because when you sit down and have interviews, there's what we call social desirability bias, where people will
okay.
want to say what the society thinks of them. So those type of conversations or local interview models, they don't tell you the reality. So when we
Um,
want to get insight from them, we
yeah.
do it via normal conversation, just chip
Conversation.
it in, and we get their real life experiences and all these things. So we'll do the active listening.
Listening.
Then the listening is also by observing what they want and how they would do it. I'll give this practical example. When we're
Okay.
implementing the IDP, the prayer project in one of the IDP camps in northern Nigeria, we had it translated to a couple of longer languages that they listen to.
Okay.
But we realized that most of them are struggling with it. But we felt that because we translated the language that they their local language that people were more familiar with it. But we now later realized that people actually preferred the pidgin English more than their, let me say, Awusa or Glabda local
Wow.
language.
Wow.
As we're observing their difficulty with it, that's one of all those things that we realize. So active listening, like
Yeah.
putting the setting where they're free to talk, then by observation and interacting with them. But in any way you want to provide mental health support, don't frame it as I'm coming to help you, right? We are
Okay.
solving a problem together. Don't
Together.
make them look as if they are the problem
Mm.
and them listen to others so I can solve your own problem. I don't know. Nobody wants to be the problem, of course,
And to
but
not feel pity.
just see them
Yeah.
as we want to. There's this problem they are facing in the country and want to solve the
Solve it
problem. So they are
together.
happy to be ones championing the problem for millions of IDPs in Nigeria.
Oh wow, that's that. I actually love the part where you shared, talking about the material that you created earlier in the Hausa language and observing them and paying active listening to them. Realize that they would prefer it in another language.
Yeah.
So that's very great. But do you actually think with your work in practice as Summer Rights Initiative and even through the Brave Arts project you mentioned, do you think these young people with lived experience, do you think they feel that they are being taken seriously?
Yes. Thank you for bringing that very important question. We make them feel they are being listened
Taking
to and taken care
seriously.
of. But sadly, this is why we need to have this type of conversations. A lot of organizations don't do
Mm,
that because in many settings where we have want to work, they are hesitant at first to work with us because we still have work with different organizations that will come and listen to them, just interview them, and that's the end.
they leave
They
them.
just leave them and they
Oh,
don't see any change. But no, we don't do that. When we get their opinion or feedback, number one, the way we have gotten the opinion or feedback is in very interesting, engaging, and conversational way, right?
mm-hmm.
Then we are committed to our cause in those places because we are passionate about it. Our team has the lived experience, among others. So we co-create solutions with them. And when we want to implement the project, they are they are involved across the different project phase of the project. Young people in the IDP camp are part of the lead experience working group, the community advisory
Okay.
group for our project. When we want to collect data for the project, they are part of the
Mm.
data collection
Oh,
among different processes, like across the phase of the project,
wow.
from the conceptualization as we're implementing the project, every part, the dissemination, the
Mm.
implementation, all
They
the
are
parts,
involved.
they are involved, and we
Wow.
visibly showcase their involvement. We don't
Wow.
claim glory for the stuff. Like we solve this problem together.
Together.
We
Wow.
ensure that their voices are heard,
Wow.
and we let them know that we are hearing your voices and we are doing this. We mention specific things. There are a lot of project changes that were made based on their voice. I remember this specific example where when we were implementing the project, we designed a curriculum that the community mental therapists. So what we do in the Brave Arts project is we train people in the community to
Okay.
identify young people in the community that have common mental health conditions
Challenges.
like
Okay.
depression, anxiety disorder, PTSD, substance abuse. They're able to identify them and
Okay.
provide basic psychological care for them. So we developed a curriculum for those community mental therapists to use to provide help. But
Okay.
we realized that some of the young people said they would love or prefer something very, very interactive that they can use, that they can write and color. So then we
Okay.
came up with the Brave Art workbook. They had options for them to color, to write, to draw,
Wow.
and all those different things.
Wow.
And we implemented that based on the feedback. Or so we listen to them actually, and when we listen to them, they also see when they give feedback or input, we make our decisions scientifically, and we'll implement that.
Wow, wow, that's very actually great to hear. I was even
Mhm.
about to ask that question that you should share with us an example, and listening to that example that you just mentioned, it shows that yeah, you actually take people with lived experiences seriously and you involve them across all stages
Yes.
of your project implementation, delivery, and the likes. That's very great. And I don't know if you, with your work in practice that you've had as Summer Rights Initiative and through the Brave Arts Project, has there been any situation or any challenges that you have done, experienced while working with people with lived experience?
Yeah, so number one challenge that we see face is stigmatization. Sometimes,
Mm,
sadly, other people live experiencing stigmatizing their fellow colleagues is a problem that we are faced. Just trying to ensure there's no
no.
stigmatization.
Mhm.
Let me say among others. Then funding has been a challenge because a lot of things that we want to do, but the funding opportunities
Okay.
are not there. And then some people have had, however, some people have had bad experiences with other networks who providing care, so they may be a bit reserved. So we have to show by our work that we welcome opinion of
From
them
them.
from them, and
Mm,
we are not like them. It's an opportunity to also implore all organizations to put this experience at the core of their work. Because we know that we cannot solve this problem together. We need all organizations passionate about mental health to be involved. So I implore all organizations working in the mental health space to put lived experience at the core and set of what they do. If they do that, as we're all working in the same networks or group to change the narrative of access to mental health care, we'll be supporting each other to make this happen.
thank you so much for sharing. And
Thank
that's
you.
even a very conclusive message to share to other organizations and even our global audience that will be listening to us right now. That it's very important to put people with lived experience, young people with lived experience, at the center of whatever work they are doing. Thank you so much for sharing your highlights. Just one last question before we call this conversation a wrap. So, what is one key message that you would want other members or people that are actually working in the same space as you are in the mental health advocacy? What do you want to share with them that they should take home from today's
Thank
podcast?
you very much. A key message I want to take that individuals with lived experience can be empowered to solve mental health challenges. Don't see individuals with lived experience as just participants of your mental health solutions. The fact someone has anxiety disorder or has depression, among others, does not mean that they cannot be empowered to solve those problems. Because they're facing those problems, they'll be passionate to solve the problem. So don't see individuals who live the experience of mental health challenges or mental illness as just participants. See them as co-solution providers, not just co-solution providers, people that can be empowered to solve
To
that
solve the
problem, and they can
problem.
take the message while it is what they face and they can do very well with it.
All right. Thank you so much for sharing your insights with us.
Thank
And
you.
it's a very great pleasure to be able to learn from you and even to get this knowledge and reflections that you've shared with us, especially with the work you do as the Rights Initiative. And this is why what we do here at Hear Us Early is to ensure that the voices and the experiences of people with lived experience are brought out to the center and brought out to attention so that wherever they need to be prioritized, young people, children, and adolescents, wherever they need to be prioritized, they need to be listened early. And that brings us to the end of today's episode. Thank you and see you next time. Bye.